The entire world is up in arms over the deadly Ebola virus. But how much do we actually know about the disease? Today we answer some frequently asked questions about the virus, which has claimed the lives of almost 5,000 people. First of all, of course, what is the Ebola virus? Now, according to the World Health Organization, Ebola virus disease is a severe illness that infects not just humans but also other primates such as monkeys, gorillas, and chimpanzees. The disease first broke out in 1976 in Congo and Sudan. Its origin, however, is unknown, although fruit bats are considered the likely host of the virus. Now, how do people become infected with the virus? Most of the Ebola cases in humans came from human-to-human transmission. That means persons infected had direct contact with the blood and other bodily fluids, such as the saliva of infected people. Infection, however, can also occur without direct contact if a person is exposed to areas contaminated with an Ebola patient's infectious fluids like soiled clothing or used needles. What are the usual symptoms or signs of infection? Sudden fever, intense weakness, headaches, and sore throat are the typical signs that a person has the sickness, and these are usually followed by vomiting, diarrhea, rashes, as well as impaired kidney and liver functions. Laboratory studies also show those infected have low white blood cell and platelet counts and elevated liver enzymes. The WHO suggests those showing signs of infection must be contained from 2 up to 21 days, as patients become contagious almost immediately. The organization, however, says infections can only be confirmed through lab testing. Who are at risk of getting the disease? Persons who are usually at risk of getting infected with the deadly virus are, ironically, those who are treating persons who already have the disease. Exposure, however, can be controlled with protective measures not just in clinics or hospitals, but also at community gatherings or homes where a person infected may have visited. What can we do to prevent this sickness? Currently, there is no vaccine for the Ebola virus, but several are already in the pipeline. So far, the best way of avoiding the disease is still staying away from those who already have it. What is the treatment for Ebola? Severely ill patients usually need intensive care, as they tend to become dehydrated. Patients can recover simply with medical care, but doctors have yet to come up with a specific treatment to cure the disease.